Hi, everybody, and welcome back. This is Markeitha. I'm your host here at Healthy Living. Welcome back. My website is healthyliving.company, and you can reach me there. I have several different items, products. I have Keitha's toast, Keitha's egg toast. I have Keitha's gumbo. But you would have to send me a message if you want that fresh. The gumbo comes with rice and hot water cornbread. Also, there's different products there. There's the Arbonne products, and you can click on the website and go shopping. Doesn't have any petroleum byproducts, anything like that. That's crude oil. So you don't want that in your product. So read your labels. So anyway, you can go there and you can go shopping. The producer of the show is T Jams, TJAMZ. And you can reach him at tjamsmusic.com. There he has a whole list of songs. You can write lyrics to them and send it back to him. You can also send him messages there on his website. He also does web design. You can contact him here as well at the Next Level Studios, 310-549-1113, 310-549-1113. People ask me, is that a real number? Yes, it absolutely is a real number. I would be doing fraudulent things if I told you something different. Now, we're going to talk about the coronavirus update. This is very, very serious, everybody. Red alert, red alert, red alert. You have to stay home. You have to protect yourself. You have to stop grouping up. You love your family enough to stay away from them and see them next year. A lot of people have been going to see their families, flying on planes, and they come back and they give those people over there the coronavirus, and then they come back and give their family coronavirus, and people are dying. We have to stop this. So please listen. This is not a joke. This is serious. So please listen. Now, if you don't believe what we're saying, go to OSHA, go to the WHO website, the World Health Organization, go to CDC website, which is the Center of Disease and Control, that reports and keeps up with all of these coronavirus cases and deaths as well. Also, I get my statistics from the World Meter. There you give you statistics for the whole world and each individual state as well. Now, the coronavirus, let me give you the numbers. As of today, we have worldwide 77,144,265 cases. As far as deaths, we have 1,699,028. We're more than 1 million deaths. That's terrible. We're closer to 2 million. This is outrageous. Now, there's been 54,040,359 people who have recovered. Now, I heard some crazy stuff the other day saying, oh, I had coronavirus, so I can't get it again. Oh, yes, you can. I had prior shows that tell you that that doesn't work. You start losing your so-called immunity after 3 months. It goes down, 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 down. So even if you get the vaccine, you still need to wear your mask and wear your goggles. Stay more than 6 feet apart whenever possible, because the virus will travel up to 22 feet, and it hangs in the air. It's airborne. It always has been. So the U.S. is the leader in cases. We have 18,258,387,000. Deaths, we have 324,840 deaths in the U.S. alone. That is really crazy. Cases, 7. Look, actually, that's the U.S. Now, what's third? Who's third? We're number 1 in the U.S. Third is Brazil. Brazil has 7,238,600. They lead second in deaths, though. 186,760. That is terrible. We have a total of new cases worldwide, 532,097. Deaths worldwide, new deaths, 7,822. That is just outrageous. We have to pay attention. We have to follow the health orders. Just because it hasn't hit you in your house yet, don't think it's not real. This is real. I just gave you millions and millions of people, our cases, more than 77 million, and almost 2 million deaths across the world. That is way too many people. You have to take this serious. Now, the World Health Organization declared the coronavirus a pandemic in March the 11th of this year. A pandemic. That means across the world. And it's gotten worse. 3, 4, 5 times worse. Now, it was first reported in Wuhan, China. If some of you guys still don't know, it did start there. And then it started traveling. At first, they thought that it was related to animal markets because they have a live animal markets in China. But then they found out it's people also. So now it's people transporting. And I'll tell you about something else in a little minute. Coronavirus is a new virus. It's SARS-CoV-2-2. Severe acute respiratory syndrome virus. Also, there's a beta coronavirus, which is MERS coronavirus, which is the Middle Eastern respiratory syndrome. And you know what? They all originated in bats. This is what they originally had stated. Now, the other thing I wanted you to know, an update from the WHO, the World Health Organization. Several animals have been in contact with infected humans, their owners, right? Such as minks, dogs, domestic cats, lions, and tigers. They have tested positive for COVID. So if you are infected, stay away from your animals because they could get affected too. So you don't want to do that. So they're still trying to figure out where it originated from. They think it's bats, but now it's going to more animals. So we have to be really careful, okay? Now, illness can range from mild to moderate to severe. So it just depends. Everybody's different. You can have symptoms like flu symptoms. So don't think, oh, I have a flu, and then you don't get in. They've been finding people dead in their homes because they're not going to the hospital. So please don't do that. If someone's having these symptoms, watch them. Quarantine them in your house. Have them close the door, but you watch them. I recommend you get a pulse ox because that can test your oxygen concentration. And what happens is the oxygen concentration, it sneaks up on you because it gets less and less and less. And by the time you know it, you're dead. So that's another thing I want you to get. So fatigue, cough, shortness of breath, chills, repeated violent shakes, I heard. They're very painful. If you listen to the testimony of people who've had it online, that's what they tell you. Headaches, sore throat, nausea, vomiting, diarrhea, congestion, runny nose, a new failure to be able to taste or smell. That's a big symptom right there. That's not a flu symptom. That's a COVID symptom. It can cause more severe illness, of course. I told you about those. And these are the signs of what you need, that you're in trouble, when you need to call 911. Persistent breathing problem. Persistent pain or pressure on your chest. It's like kind of like when you feel like you're getting a heart attack, right? New confusion. When you start changing colors, your lips are blue, purple, sometimes in dark complected. Black people, is like a grayish color in your lips and your face. Now, who's more vulnerable? Now, we all are vulnerable now. It used to be just old folks with different type of medical problems, but that's not it anymore. We're all vulnerable. But the ones that are most vulnerable are the 65 and older, including infants too now. They are dying. You heard about that one child that died last week. So children are not, they're not exempt. So parents, you got to protect your kids too. So, also, you need to protect yourself by wearing masks and social distancing. We have to decrease the hospitalizations. The list that I gave you, those have more increased chances of going to the hospital or ICU or being intubated or being on a ventilator. And a lot of times when people go on a ventilator, they die. So these are the kind of health conditions that will cause, that increases your risk for that, okay? Talking about hypertension, chronic respiratory lung disease, asthma, COPD, chronic kidney disease, sickle cell anemia as well, cancer, autoimmune suppressive disease, HIV, leukemia, cancer, even thalassemia. That's a type of anemia. So we have to make sure that you keep your blood levels appropriate for making appropriate red blood cells, which is I take B complex for that every day because I have thalassemia. Post-chemotherapy, diabetes, more so in diabetes type 2, but still diabetes 1, but more in type 2. They're still doing research on why it's not as much with type 1, but it does impact type 2 a lot. Smoking, pregnancy, and obesity. Now, for children, they have what they call a multi-symptom inflammatory syndrome problem. It kind of mimics the Kawasaki disease. So what happens is with children, they get severe inflammatory syndrome, which impacts their organs, multiple organs. Their symptoms, they can have the same kind of similar symptoms, but a little bit different. They have the fever, the diarrhea, the body rash. Kids get body rash, especially if they have fevers. So if your child is used to running around and all of a sudden they sitting down, you need to check them for their temperature because they may have a fever because kids don't sit down. Okay, so that's a clue for you parents. Also, extreme red and swollen tongue. It looks like almost like a strawberry almost. They get redness under the palms of their hands and their feet. They get red eyes without drainage, which is another symptom for us as well as adults. It's like pink eye, but you don't have the drainage. You just have the discoloration. They get the joint pains and they have inflammation in all of their organs. Now, according to Peter Russell, December 12, 2020 in Medscape, the UK coronavirus update, new variant SARS, new mutations of SARS. Maybe if you saw my show maybe about a month ago, I talked about how there's already mutations being discovered. Okay, this is the one in UK, also in the US. Now what happened is they had to shut down and be even more serious on staying at home because of this mutation. Now, according to Matt Hancock, the Secretary of State for the Health, Social Care, a new variant of SARS had been detected in the UK, was given faster than existing variants, meaning this is happening very quick. Identified over 1,000 cases with this variant mutation, predominantly in Southeast England. Currently, nothing suggested that this variant is more likely cause serious disease and or they need to have more research to find out if it's going to be responsive to the vaccine. So they don't know yet. So these are things that are still new. It's still ongoing. So that's why you have to protect yourself. Now, the variant that they call the mutation is called cluster 5. Now, that had a combination of mutation of changes that have not previously been observed. The implications of the identified changes in this variant is not well understood. Preliminary findings indicate that particular animals, mink animals, variant identified in both mink and 12 humans cases have mildly decreased sensitivity to neutralizing antibiotics. So with this new mutant strain through the mink form, the humans gave it to the minks, then the minks get it, and then they give it back to the other humans, and this is the mutation. Further science and laboratory, so they got to do further studies to evaluate this, because we have to find out what's really going on, because if we get this serious mutation, every time it goes from person to person, there's a tendency to mutate, especially when it goes from person to animal, and then animal back to humans. So you have to really be careful. Still get your vaccines when they come around. Always get your vaccine. We have to try to do what we can. Now, what they're going to do is they're going to get rid of those particular animals, unfortunately, but they're posing a danger to humans even more so than anything else. Now, it remains, when any animal virus spills into human population, or when the animal population can contribute to amplifying the spread of the virus affecting humans, as viruses move between human and animal population, genetic modifications in the virus can occur. So the 6 different countries that they have identified is Denmark, the Netherlands, Spain, Sweden, Italy, and the United States reported some of these different mutations, these cluster 5 mutations of the coronavirus. So what they recommend is that thinning the herds out, also creating a different genetic type of formula for the meeks so they can change this response. This is they said that there's there's 7 million forms. I didn't know it was that many. Also, Denmark is including breeding stocks. They are enhancing surveillance on local population to detect the coronavirus cases, including those population widespread, testing regions in North Jutland, expecting the percentage of subsequent humans and SARS and meek infections in Denmark. So if you're going to Denmark or England, I think you need to cancel your trip at this point, but no one should be flying right now. You should stay at home. You should not be flying. I'm sorry, but schedule your trip for next year. Now, there's more restrictions that they're going to be introducing to try to halt some of this stuff. Now, I want to tell you about some things that you can do to take care of yourself as well. Now, in order to build your immune system, you should increase your zinc products. Avocados are great for zinc. Avocados, almonds, cashews, blackberries. Now, I know some people don't like to get berries because they go bad really quickly. But if you wash them and freeze them, you can take them out as you need them. That's a way to keep that going. Also, you can also take broccoli. Broccoli is a good one for zinc. Also, if you don't have it, you can also take zinc as a supplement as well to make sure that you have enough for your immune system. B complex, like I stated, it helps to improve your immune system as well as taking vitamin C, vitamin D. Those are the ones that you need to make sure you have enough of to keep your immune system strong. Now, also, coronavirus don't like acid. So you can increase your consumption of oranges, lemons, pineapples, all of those different things that have higher acid level. And believe it or not, avocado is for both. It has good zinc and it has enough acid content to help kill the coronavirus. So you want to be mindful of that. And don't forget about the garlic would help also with your immune system, to build your immune system. So either eat you some garlic cloves or get you a garlic supplement. As long as you get your garlic in, it doesn't matter. Now, you should be doing your supplements if that's what you're going to do every day, or eat your food sources that are every day. Two things: to build your immune system and to increase your acid content. Now, another thing that I like to do in the mornings is gargle. Gargle with mouthwash. It doesn't matter which one, but there's research that has proven that when you gargle in the morning, make sure you cough, then gargle, and get rid of that stuff. Get that out of your throat. Now, whenever you have products that are coming in your home or you bring it in from the store, wherever, the mail, you need to wipe them all down. Now, you can use antibacterial soap, lather it up and wipe everything down. You can get some bleach and put 1/3 bleach and the rest water and put it in a plastic bottle, and you have your Clorox spray. So however you want to do that, Lysol and Clorox wipes, those are rare. So this is another way that you can do that and still save money. Because a lot of times you buy the wipes and the Lysol wipes, they're expensive as heck. Why? When you can buy a big, huge gallon of bleach and put 1/3 in a plastic container and 2/3 water, and you got your own Clorox spray. Okay, another thing that's really good is using the neti rinse to clean your sinus and nose out. There's another one online, Neti Potty. You put it in there and it sucks it right out. What it does is it gives you this bicarbonated sodium. The packages, they come in and you put it, package in there. Use warm water. Cold water was irritating to me, but you can decide which one you want to do and fill it up to the line, shake it up, and then pull your nose and your mouth over the sink, and you can swish through and clean out your sinuses. Man, this works wonderful. I'm telling you, it does. If you're feeling congested, then you need to do one of these rinses. So remember, your doctors used to tell you that. It's true. You start blowing your nose and you clearing it out, even your ears, Your ears, nose, and throat is all connected. They're all there with the sinus pathways. So you can clear all of that crap out by doing that. So whenever I'm out, I like to come back and I do this rinse. Also, I want to teach you about protective equipment. Now, as nurses, we use what we call N95. So we are fit tested, so we have the N95s. You know, it has, meaning that 95% of the coronavirus will not get to us. So we put it on and we're fit tested, right? Okay. Now, we also, you'll see us, in case you go to the hospital, you'll see us in gloves, right? You see us in gloves. You'll see us in face shields, right? You see us in face shields too, right? And then, of course, we're going to have on our gowns. These are water-resistant gowns that we have to wear, okay? So you're going to see us in all of this stuff when you see us in the hospital. And then there's different types of headgear, like what they call the poppers, that have a machine that protects the whole face. It goes over the head and it has tubes in it and a power pack on the side. So you'll see us in that sometimes. Now, for the general public, and we'll have goggles too as well. There's goggles that we'll wear. You'll see us in those things as well, because you got to have eye protection as well. There's proven research that the coronavirus gets into the eyes. Now, what I brought are goggles on the internet that are better to me than the ones that work. I get the kind that are, say, anti-fog. And if you need it to fit over your glasses, you can get these, the ones that fit over the glasses. These fit very snugly on my eyes. You want to get the kind that's not vented on the side, either indirect vent or no vent, and then you're protected with eye coverage, right? It's closing your eyes. So then if you want to still add a face shield, you can. You can add your face shield, right? That's another layer of protection, right? Now, the other thing, far as your mask, you can wear any types of masks. You can even wear a mask over the mask so you don't have to wash, right? Okay. Now, I don't care what kind, but make sure it has at least 3 layers. 5 layers are better, and you wash them every day. Now, if you don't have the money, fine. You can get you a piece of cloth, tie the bottom of an old t-shirt, cut it off. All you need is a square, right, to make your own mask. You need a square piece. So then you fold it in half, and then you fold down another quarter on each side. Depends on the size of the mask is what you determine how big it is. You get these stretchy bands or a rubber band and put it on each end, and you fold it over. You do that on both sides, and you fold it over. Depending on the size you want. So they all folded like this. So you grab the band, the rubber band, or the elastic band, and you put it on. So you have a mask completely covered. Now, I don't want to see anybody with it down here. You're not protecting yourself. Your nose is out. People exhale, and you can inhale it still in. It don't do you any good to have it down here under your chin. What are you protecting? Absolutely nothing. So you got to wear it properly. You got to cover your mouth and your nose. Okay? There you go. Say, for instance, you should always have a backup in your car as well, or in your purse. Now, another thing I wanted to let you guys know, some people say, oh, it fogs up. Okay, so there's different products online for anti-fog, and you spray it. I think I sprayed, after about 3 times spraying it, it gets better and better. Before you go to bed, spray it on there and let it dry, and it gets better. So you can spray it on your eyeglasses as well. That's what I do, because I wear glasses sometimes. So get you some anti-fog spray. Those are the things you can do to protect yourself. That's the bottom line. And then say, for instance, okay, I still don't have no cloths. I don't have any old t-shirts to cut up. Well, get you some paper towels. Yep, paper towels, right? Fold them up. It's still another square. Do the same thing. You fold the ends down on a quarter on each side. Depending on how big you want the mask to be, then that's what you do. And then you take the rubber band, put it on the end of each end. Rubber band or elastic for the hair. And then you have to determine the size you need for your mask. And then it's still, you fold it in, right? And you grab the rubber bands or the hair bands and you put it over your face. So, everything's covered. So there's no excuse to not have a mask on. You can make it, you can buy it. It's up to you. But there's no excuse not to have on a mask. And this is why people are getting more and more infected, more and more cases, because people are not following the instructions to wear a mask. And I tell you, wear goggles too to protect your eyes, because the coronavirus is getting into the eyes. So you need to do both. Wear your mask, wear your goggles. Keep an extra pair in the car. So if something breaks, or sometimes the rubber band may break, or the band that you buy, it may break, so you'll have a backup. But if that ever happens, it's not important that you continue your shopping. You need to think about your health, okay? So that's what I want you to do. You have to protect yourself. Now, the WHO advises further virological studies and research, and they want them to share it with everybody. So all the different locations that I mentioned, even including the United States, we have to all get together and start doing some research and share the information with each other. Now, the World Health Organization and the CDC, they get reports on every new virus. Every time there's a new virus or every time there's a new death, they get these numbers. So they have to keep control and keep a running record of the different cases, where they're located from, who it is, if they have medical problems or not, the age. All of that information is given to CDC and the World Health Organization. So if you don't believe me, you can go to CDC and you can go to the World Health Organization. That's who we call the WHO. Okay, it's abbreviation for World Health Organization. CDC, Center of Disease and Control. That's the CDC. Now, you want to avoid close contact with people, especially if you hear them coughing or sneezing. Get away from them. Now, make sure that you're washing your hands frequently. Now, I told you to wear goggles as well as a mask, because it gets into the eye as well. And if you have a face shield on, it's going to still get under your face shield. You see that? All that right there, all up under there, because it's in the air. So if it's in the air, it's going to get under your face shield. So to me, even CDC recommend goggles as the #1 eye protection. Now, before, you want to make sure you always practice good etiquette. When you see these people on the news coughing at people, taking their mask off, that is just like attempted murder. That is just so ridiculous. And I'm glad they're finally arresting these people when that happened. So when you find someone who's doing that, then make sure you call the police on them, because they need to be arrested. Keep your distance. Remember, I was telling you that it's proven research that the virus will travel horizontally and vertically, and it lingers in the air. And depending on the room, it can linger for up to 2 hours. So if someone left the room that had it, and then here you come in behind them, you can still get the coronavirus. That's why it's important to have masks and goggles. And this is what happened, the research, when there was restaurants, this is the research they gathered that from. So it can happen. Now also, Now, some people are still going to travel, which they shouldn't, but they should do these things before they do something like that. They should make sure that limit the activity, first of all. You shouldn't do it. But there's people who don't listen. This is why we have a pandemic, because people are not following all the health orders. It has nothing to do with whether you're a Republican or you're a Democrat. It has to do with you're not wearing the mask. We all die. The Republicans are dying too because they were out there not wearing masks. So this is not political. This is something you have to do for your health and your safety. Now, if you're going to go places, if you're visiting with family, you have to visit with them outside, where there's airflow and there's plenty, and then make sure you're 6 feet at least or more when you sit and you're talking without your mask. Okay, so what we're going to do is we're going to come back, we're going to take a break, and I'm going to show you some exercises to help you deal with your stress. Instead of eating, exercise. Okay? So I'll see you in a few minutes. keep yourself from being stressed and stay healthy. So I'm gonna teach you lying, sitting, and standing. So there's no excuse not to exercise. So these are what I call couch sit-ups. So if you haven't done them before, if your abdomen is really large, then put your back up against the arm of the couch. You get your arms and always hold in your abs. Okay? Then when you get more advanced, you can scoot down. Remember, holding your abs, 3 sets of 10, work those arms, and then when you get really good, all the way, hold in the abs and do the same thing. Right? Okay. Now, let's finish what you can do lying down. Okay, so, and it's gonna work. So if you're doing them, you're gonna get sore if you haven't been used to exercising. So, you're laying down. This is just a retention band that you can use to help you if you need help. Put it under your foot, right? So then you can help pull your leg up if you haven't been exercising. Otherwise, you can do it on your own, and then you can pull them both up at the same time. You can do that as well. Now, another thing you can do, wait till I finish. So, you can bend your knees, right? Now, another thing, put your palm of your hands down, face down on the ground, hold your abs in, and lift up. Now, you can do 3 sets of 10, or you can hold it, right? Now, when you get more advanced, you can lift up and slowly straighten your legs out, but hold yourself up in the air, right? That's when you get more advanced. Now, isometric, you can take your abs, hold it in, let it out. Hold it in, let it out. Hold it in for 30 seconds, or you can do 3 sets of 10. Now, in this position, you know, all this inner fat right here, I used to be jiggling like a bowl of jello, right? So for this exercise, you open your knees and you just open and close. They have that Thigh Master, and then you can put the band on to give yourself more resistance. You can do that. You can tie it off, so then you get greater resistance for that, right? Okay. Now, nothing you can do. Straighten out. You can lift your leg, right? 3 sets of 10 individually. And then when you get stronger, you can lift from the bottom, a little low, 3 sets of 10, holding your ab in. You don't want to use your neck, so keep your back on the ground. Use your abs and your thighs and your butt muscles. So this, then you can go higher, right? Holding your abs until you can go all the way, right? And then go slow, because if you're going to put more resistance, go very slow. That makes your muscles work harder. So that's when you get a little stronger. Now, another thing you can do, oh yeah, you can do the scissors, right? Do the scissors. Now, for what's good for your back, but this is good for your love handles, that big roll of fat on the side, right? Man, I used to have a big one. But anyway, you can let your leg go down, right? Let it go down wherever you can go until you can get it all the way down. And this is a good way to stretch your back out as well. And then remember, do it on both sides. I'm giving it to you, but I want you to do it on both sides. You have to do both sides. Another thing you can do is go from side to side. If you can't go all the way, go where you can go until you go all the way. And go back and forth. This is for the love handles too. Okay? So this is a good one to do as well. And if you're having back pains, you can stretch like this and it'll stretch your back out. At the end of your workout, you can do that. Now, another thing, turn over, Then what you want to do is bring your heels up, because this is for the back fat and the buttocks and the thighs, the dimples that you can get in there. So you do these, and you just pull them up. If you're having knee pain, then you just gotta go like maybe halfway if you have knee problems. But if you can't go all the way, go all the way. And if you have to do it slowly until you get there, then that's okay. Okay, so that was the things you can do while you're lying. Now we're gonna do some things while you're standing. Okay, so while you're standing, whether it's your dresser or a table, you can hold on to. You can do leg lifts, whether it's low, medium, or high, right? And remember, hold in your ab each time, right? So you need something that's not going to swivel until you get strong enough. Another thing to do is hold yourself up, because you need to develop your core. So you need to hold yourself up at least 15 to 30 seconds and then switch. I couldn't do it at first either, so don't worry about it. But have somewhere that you can hold on to until you can get it done. The object is to hold in your abs, hold your thighs and your buttocks to keep you steady. Then you can hop, you can go different places. That's good for you too. Okay, but get that, and that'll be great if you can do that. Now, another thing, also, while you're brushing your teeth, you can do like calf lifts. And you can do those in the morning. See, you're up on the balls of your foot, close to your toes. So you're up there, and you can see it engages your calf, right? So you could be doing this. I used to do this in the morning when I'm brushing my teeth. So you're doing exercise while you're brushing your teeth. You can go up all the way. If you can't go all the way, then go a little bit. But try to get higher and higher until you can get all the way up on the ball of that foot. Okay? That's the best thing to do. But if you're just getting started, go where you can go, and then until you get even higher. Right? And if you got to hold on. I had to too at first, until you get a little stronger. In the meantime, you're going to hold your abs in the whole time. Okay? Now, another thing is squats. So, you do your squats, you're going to have your feet apart. If you have knee problems, then you want to do more of a sit back, stick your butt out, squat. If you have knee problems, take the pain off your knee. So you're going to sit back, squat. Okay? If not, then you just squat. Okay? Now, I'm going to give you my called standing sit-up. Sit-ups everywhere. Laying, sitting, standing. Okay, here's the sitting, standing. You want to make sure, if you have back problems, you go slow so you don't get back spasms. So you want to just slowly go down till you hit the ground. If you can't go that far, go to your knees, you can go to your calves, you can go to your ankles, and then the top of your feet, and then the bottom. But you want to go all the way up each time, and then go to the side. The same thing, to the side. Now don't turn to the side, just reach to the side. And then mix it up and go in the middle. Okay, those are your standings, right? Down. You get you some weights, and you can always mark in place. Low, you can go high, then higher, right? And moving your arms too. If you don't have the weight, so what? Check it out. Get you some water bottles, okay? It's no big deal, as long as you're moving. Okay, let's do some sitting. Now, if you're at home and you're not used to doing it yet, you can do what I call sitting squats too, which just means you're sitting down and you're getting back up. If you think about it, those are squats too, but they're supporting you. They're not as hard. So they're sitting squats. But you want to make sure your chair is secure, or if you're on your bed, then your bed is secure, so you don't move and fall, right? Okay, so we do those. So, and get back to these. So, with these, you can march, and when you're marching, meaning by lifting up on your ball of your feet while you're working your arms. If you don't have the weights, then you can also do lifts, right? Holding your abs, and you can do 3-point, up, out, up, down. You can do that too, right? So there's different variations you can do, and I'm showing this so you can change up your routine, because you have to. The body get used to one particular exercise, so you got to change it up. Now, you can also do your lifts, so you want to make sure your back is all the way supported, and you want to lift both feet. Lift them up. You can do multiples, 3 sets of 10s, and then you can go higher, depending on, once you get stronger and get further along, right? So you can do those things. Now, again, for this inner thigh here, you open and you close. Now, you can throw in some arm action while you're doing that too. You can always do that. The more you can get your arms involved, the better. Okay? So whether it's water bottles, whether it's the weights, just get them involved, right? And you can do these curls for your arms. You can also lift them up a little bit. Okay, so anyway, my mic got buried while I was exercising. Okay, so the bottom line is get to moving, right? Get to moving. So nothing you can do with your arms is get a resistance band, and you can put on one knee, put it up on the top of the chair. And you want to support it so that your arm is supported. You don't want to cause strain on your muscles. So you want to support it and do curls, right, with your resistance band. And if you want it more resistance, then you open your legs further, and that gives you more resistance. So that's another way you can do that. And then you can, I'll say, pull your arms apart. And you can hold it. You can do you can go in, but don't go all the way to exercise. Right? You can go out further. You can hold it 10 seconds, 3 sets. And you can count. This gives you greater resistance, and this is good for the back of your arms as well. Now, if you want to do the bottom back part of your arm, you can put it up and do it this way, and then you can have resistance, right? And do the same thing. So there's many ways you can do that. You can also, if it's just an arm problem, you can do circles. You can do front, you can do back. Greater resistance. 3 sets of 10s. You can always do more, but just know if you haven't been moving, you're going to feel it. Now, there's also chair sit-ups, right? Open legs. It's the same principle. You're going to go down, right? And you're in a chair, so you're supported. You're going to go down. And then you're going to go to the side as well. So you're in the middle. So if you can't go all the way, go to your ankles as you're sitting. To your ankles, or go to your calves, or the top of your foot, and then go to the bottom. This part right here is a good way to unwind, is to just hold this here for 30 seconds as well, and it stretches out your back as well. So you got sit-ups, lying, sitting, and standing. Now, I'm going to introduce you to my new buddy. It's a peddler. I got a cubie coming, but it has to be put together. Got to put the pedals on this stuff. So, producer of the show is going to do that for me. But this is great because you can tell I really use this baby. You put it on while you watching your favorite show, right? So we all got a favorite show. Now, if you have knee problems, you can push further back so you don't have such a high mountain to climb, so it's less strain on your knees. It has a retention where you can make it harder or stronger. It did have a speedometer on it, so it can tell you how many steps or pedals. But look at it this way. While you're watching Power or FBI or SWAT, whatever your show is, superheroes, whatever. By the time you realize the show is over, you've exercised for a whole hour. Now, don't forget to throw in the arm movement with it, okay? Because you want to do both. But by the time you get to maybe two commercials, you're 30 minutes, right? By the time you get through 4 or 5, depending on the show, some commercials are really slow, like LA Finest. They don't have that many commercials. So depending on the commercials of the show, but if you do the entire show, that's a whole hour. And you can speed it up. You can change the resistance on it. But that gives you your 1 hour workout for the day. And then if you do those, the toe lifts and stuff, and do some of the couch sit-ups or standing or however you want to do your sit-ups in the morning or your squats, those are extra minutes. That's all good, right? It's all good and it's healthy. So when you get frustrated or stressed, get on your peddler. Start exercising. Don't overeat. Another thing, if you are overweight, you want to drink a whole glass of water first before you eat. And don't eat so fast. A lot of times people eat 3 to 4 times more than what they really need to because they're eating too fast. So slow down. You'll see what I'm talking about. And 50% of your plate should be fruits or vegetables. Not rice and potatoes. No. Fruits and vegetables. Okay? Now, it's real important that you guys take this stuff serious. This coronavirus is no joke. We all have to wear masks. We all have to wear goggles. It's just the way it should be. Social distancing. Nobody should have to tell somebody, hey, get back. But if you got to remind them, remind them. Don't let them get too close to you. Okay? You have to do that right. Now, the other thing you have to remember, stop grouping up. There's been several families that has been on TV that they went and gathered for Thanksgiving, and now several family members have died. Do you want to live with that? No. There are several families where they were going to the aunt's house. The aunt was sick. She didn't tell anybody. So their whole family got sick, and 2 out of the 4 died. For the visitors, because they weren't in their household. And one was a comedian, he was a famous comedian, and he died. So you have to ask the question, like I said, if you don't listen and don't think it's real, and you want to group up anyway, you need to ask the question, is anybody sick? Sneeze, coughing, fever, and if they are, don't go. Don't go. Now, if they've been exposed or they have a COVID test and they're still pending, don't go. If you have some flu symptoms, get tested. Don't go to their house because flu symptoms are similar with COVID. So don't just blow it off. Oh, it's no big deal. It's my sinuses or it's my allergies. Don't go. Love your family enough to say, hey, I love you, I miss you, I'll see you guys next year. Don't get on a plane. I know you guys saw that on the plane, on the news. A person got on the plane, knew he was sick. The wife knew he was sick. And he died on the plane. He died on the plane. Now, later, the wife said, oh yeah, he's had COVID for a week. Well, that's not long enough to quarantine. And you shouldn't be on a plane. So you have these carefree individuals who don't care about other people that put you in jeopardy. So the best thing for you to do is to stay off the plane. Don't go on a plane. Don't go on a train. Don't go on a bus. Stay home. You can FaceTime them. You can Zoom them. Love them enough to stay home. I'm sorry, but this is where we are in this pandemic. You have to listen. People are dying. It's not like they got syphilis and, oh, okay, I can go get an antibiotic and I'm good. It's not the same thing. People are dying. It's not like, oh, you get pink eye. Oh, now Cousin Benny and Mary Lou had it. Oh, okay, no problem. I'll go get some antibiotics and it's over. It's not. And then for us nursing and doctors, we're overwhelmed in the hospitals. We're totally overwhelmed. And I really want you guys, if you really are sick, please go to the hospital. Don't wait. Don't wait. Go. Because we're finding too many people dead in their homes. Bobby Brown's son was found dead in his home because he had a fear of going to the hospital. You guys see all this stuff on the internet every day. But I don't want other medical problems like you think you're having a heart attack. You got chest pains, you need to go to the hospital or call 911. Because you could be, if you especially got heart problems, you could be having a heart attack. And then it's too late for you. So don't be so scared to not go. Because they will protect you. So I want you to go if you're sick. If you need to see your doctor urgently, call your doctor. Your doctor will do a telephone appointment. If it's something urgent, you will get an in-office visit. Don't not take care of yourself, because if you don't take care of these so-called comorbidities, meaning other things that can increase your risk to die or get you on a ventilator or get you in ICU, hypertension, cardiac disease, respiratory disease, asthma, COPD, cystic fibrosis, kidney disease, autoimmune disease, even anemia like thalassemia, diabetes, obesity. So I want you guys to lose weight. Take this time and start losing weight. Eat your fruit instead of drinking your fruit. Cut the juices out from the children. Give them bowls of fruit. You can order online now, so there's no excuses. There's not a big supermarket in your neighborhood. You can get Instacart, you can get Amazon groceries, even Walmart delivers groceries. So there's no excuse not to eat healthy. Nobody should be drinking 100% milk. That's for cows, not for people. It's too much fat. So remember, take this serious. Wear your mask, wear your goggles. Wear it every time. Try not to go out as least as possible. Don't group up. Stay home. Now, I will do another show probably another couple of weeks. So if you need to reach me, it's healthyliving.company. And there you'll see my different products, Keita's Egg Toast, Gumbo. I have Arbonne products as well. Watch my prior shows. You can click on the previous link and you can watch the other coronavirus shows, because there's different subject matters with each show. Also, if you need to send me a message, you can, or you can contact me here at the Next Level Studios at 310-549-1113, 310-549-1113. The producer of the show is T-Jams, T-J-A-M-Z. He has a whole list of songs there on his website. You can write lyrics, send him a message. He does web design. You can also reach him here at the Next Level Studios at 310-549-1113. And stay safe. Wear your mask, wear your goggles, stay home. Stay safe. Exercise. You're stressed, exercise. You can't sleep, exercise. You can also get you some melatonin. It's a natural way to sleep. Take it an hour before you actually want to sleep, and you'll go to sleep. So there's different ways you can do that. So in the meantime, stay safe, stay home, wear your mask, and wear your goggles. Okay, I'll see you in a couple of weeks. Bye-bye. Merry Christmas and Happy New Year's. Okay, bye-bye. Stay safe. Wear your mask. Bye-bye. Can they still see you? No. Wear your mask, wear your goggles.